Hello everyone, we are once again into the sphenoid, and now we are going to take a close look at the lesser wings and the spine of the sphenoid. Now in this anterior view, here are the lesser wings. As you can make out, it has an anterior border here, a posterior border behind, a superior surface and an inferior surface. And you can also make out that the inferior surface forms the roof of the orbit, and it forms the margin over here of the superior orbital fissure. Now this anterior border over here articulates with the orbital plate of the frontal bone, and to this inferior surface is attached the levator palpebris superioris and superior oblique muscle of the eyeball, and at this corner you have the opening of the optic canal containing the optic nerve and the ophthalmic artery. Actually, the lesser wing here medially has two roots, and between these two roots you have the formation of the optic canal. Now you can see those roots from the superior view. So let us look at the superior view. See, here you can again see the lesser wing of the sphenoid, and here are the two roots, and these two roots enclose the optic canal over here, and this is the superior surface of the lesser wing. And in continuation with the jugum sphenoidale, you can make out that this will probably be related to the lower surface of the frontal lobe of the brain, and this anterior border is that border which was to articulate with the orbital plate of the frontal bone, and posteriorly here you have a free border. This free border insinuates itself into the lateral sulcus of the brain, and along this border you also have the sphenoparietal sinus opening into the cavernous sinus. Now this posteriorly the lesser wing ends as the anterior clinoid process, and this anterior clinoid process has a number of attachments. You can already see that it is attached to the middle clinoid process by the caroticoclinoid ligament, which is ossified, forming the caroticoclinoid foramen, which transmits the upturned end of the internal carotid artery. And you can see that the anterior clinoid uh, process is attached to the is connected to the posterior clinoid process by an interclinoid ligament. Both these ligaments have ossified over here, the caroticoclinoid ligament as well as the interclinoid ligament. Not only that, the anterior clinoid process gives attachment to the anterior end of the fixed margin of the free margin of the tentorium cerebelli. Now this tentorium cerebelli is a crescentic fold of the meningeal layer of the dura mater. Now this tentorium cerebelli has a free margin and a fixed margin. The free margin is attached to the anterior clinoid process, whereas the fixed margin from underneath comes and gets attached to the posterior clinoid process. And between these two attachments there is a triangular area which forms the roof of the cavernous sinus. So now, after this discussion of the lesser wing of the sphenoid, let us take a look at the spine of the sphenoid, which is actually at this corner. It is downturned, so you can see it in this view. So here you can see the spine of the sphenoid, and the spine of the sphenoid is the posterolateral corner of the greater wing, and the spine of the sphenoid has a number of ligamentous attachments. It gives attachment to the anterior ligament of the malleus, coming from the malleus of the middle ear, and it goes on to become the sphenomandibular ligament, going from the spine of the sphenoid to the lingula of the mandible. This is a remnant of the first branchial arch from the sheath of Meckel's cartilage. Apart from that, it has a ligamentous attachment to the lateral pterygoid plate, the pterygospinous ligament. Again, it gives attachments to two muscles. One is the tensor veli palatini, which is a muscle of the soft palate, which begins its attachment from the petrous part of the temporal bone, goes on to the spine of the sphenoid, and this is the line of the tensor veli palatini. And posteriorly, it gives rise to another muscle which actually passes posteriorly, that is tensor tympani. So not only that, medial to the spine of the sphenoid passes the cartilaginous part of the auditory tube and the chorda tympani nerve, and lateral to the spine of the sphenoid passes the auriculotemporal nerve. So the nerve supply of all the major salivary glands is close to the spine. The auriculotemporal nerve meant for the parotid gland, and the cauda tympani nerve meant for the submandibular and sublingual glands. That's all for this video. Thank you.